As a future registered dietitian nutritionist, you will be determining the health and nutrition status of clients or patients in the future. You'll be trying to move them all to the most desirable or optimal nutrition and health status that you can achieve. But when you start, some of them will in fact be malnourished. In some cases, it will be a case of undernutrition. And in other cases, we'll see health effects because of overnutrition. If you, as a future registered dietitian nutritionist, are interested in what should I teach the American public? What are the messages that I am trying to get out there, especially as I'm talking to groups of people rather than one individual? There is a document that is released every 10 years by the US government. We're currently under Healthy People 2020. So these are health objectives for the whole United States. You can find them at healthypeople.gov. Again, the suggestions are based on evidence as well as being based on the kinds of issues and problems that we see in our country. A lot of the objectives don't deal directly with nutrition. For example, they may deal with lead screening in children or availability of prenatal services, particularly in rural areas. But many of them do actually deal with nutrition, and here is a list of the nutrition-related objectives from Healthy People 2020. So you can see the iron deficiency among children and females of childbearing age and pregnant women is one of the things that will be addressed. When we assess the nutrition status of an individual, we will look at their family and personal history. We'll look at anthropometric data. Anthropometrics is just a fancy word for measuring the body. Height and weight will tell me a lot. Percent body fat would be another kind of body measurement that is useful. Biochemical assessment is going to be primarily blood tests, also possibly urine tests. Hair analysis would fall into that category. Not really too useful nutritionally, at least at this point in time. Clinical assessment calls on the clinician or the practitioner to assess what the patient is reporting. How does the patient look? What are they telling you? Do they appear to have energy, or do they appear to be pretty listless and non-animated? If you were talking to an elderly woman who tells you that 3 months ago she was able to still clean her house and go out for her own groceries, and now she doesn't feel she has the energy to clean and someone else has to buy the groceries, then you know that clinically something has changed in her functions and her abilities over the last 3 months. The dietary assessment, you will collect information on current intake and past intake, compare those to the desirable standards and see what in fact could be changed. And then don't forget the environmental assessment. Who else is the person living with? How available are grocery stores with a good variety of produce? What are the financial constraints that your patient or your client is working with? A few more slides on this. As far as the professionals who are allowed or who are good at providing nutrition-related advice, we know the physician certainly is probably, the physician and their partner nurse are going to be excellent at maybe screening. They don't have a lot of direct food information, and so it really is the registered dietitian who is the health expert with the knowledge to interpret the science of nutrition into the foods that someone will actually agree to eat. This may take some education and some counseling and some time. By the way, if you notice this, the registered dietitians are now also calling themselves registered dietitian nutritionists, or RDNs. At this point, everyone can choose which title they would prefer to use. What I've seen is that perhaps most older dietitians like me, and in healthcare, we are staying with the RD. We don't want the N there because it looks too much like nurse. And when I say RDN, am I some kind of special nurse? We fought for a long time to get recognition for what RDs can do. But younger dietitians and out in the community more so are embracing the RDN and like the concept of having nutrition back in our title. It will be your choice which one you choose to put after your name at some point in the future. A few comments on genetics and nutrition. There's a rather large company in Milwaukee that will offer you diet advice based on your genetics. Well, the state of evidence is not yet at the point where we can analyze DNA and come up with specific dietary suggestions, but I think that time will come. It will come in the not too distant future, and many of you will be able to practice adding genetics to the biochemical tests that you are able to use in assessing a client. We know that DNA directs how our body uses nutrients and how those nutrients will be reassembled into the structures and compounds that our body needs. So the linkage there is, in fact, quite obvious. I want to skip over this slide for the time being. But I do want to make the point that we often also think about health conditions as having strong genetic links. We know that when one or two parents is obese, the chance that offspring or children will be obese go up greatly. Diabetes tends to have some genetic linkages, and that we can go on and on. But heredity is not destiny. And when we know that we have this family predisposition, we can certainly try to get on top of this early in our life and eat nutritiously and exercise, control our weight, and stay in touch with a physician for medical treatment that is appropriate. We're not yet at a point where gene therapy is available for a lot of conditions. We may actually be starting to see some of this when someone already has cancer. But we know that when DNA is damaged, there are now a lot of investigation into the idea that we can grow normal DNA, package it in a virus, and deliver it to the affected cells. So look for more gene therapy coming into the future of medical treatment. One thing that we've always said, and that you will hear repeatedly as you go through the dietetics program here, is that we are aiming for an evidence-based practice. What this means is that we look at scientific research to determine best suggestions, to determine nutrient needs of individuals and groups. I always want to say that I'm using this strategy, I'm using this product because the best practice and the best research that is available supports that this is what I want to do. Not surprisingly, dietitians will develop a rather strong sense of research and the scientific method. Would you take the time and read through this slide on the scientific method? It does walk you through some hypotheses that relate to carbohydrates and fats and weight reduction diets and the processes that were followed in appropriate scientific method. We get our research information in many cases from, we at least start to generate our hypotheses from laboratory animal experiments. But there's no lab animal that is the exact same as a human being. And so we ethically can't do some research studies in human beings, but we can look at, for example, migrant studies. What happens to someone, let's say from Vietnam, who moves to the United States and begins to consume the more typical American diet? We'll also talk about cohort, case control, and double-blind studies. Those studies do need to be repeated. One experiment is not enough to say, hands down, this is true. But when we see multiple studies that support the theory or the hypothesis, then in fact our hypothesis becomes true. If you're a practitioner, you don't always have time to sit down and do a full lit review of the evidence, but there are organizations, and we will show you the evidence analysis library that is maintained by the Academy of Nutrition and Dietetics. And so if I want to know what is the research telling me about the role of dairy product consumption in health, and I want to find my answer in under 10 minutes, I can log into the evidence analysis library and get that answer. Okay, the last part of our chapter here, I'm going to ask you to go ahead and read through this information on claims. Do remember that the supplement world in particular is not really monitored and the consumer is not protected. This is a typical supplement food label. So it doesn't have a lot of information, and it just does tell you that it is not evaluated by anyone. Pretty much a consumer beware, and we will be moving much more into these areas as we go through the course. Okay, end of chapter 1. I will let you know that this is out there, and boy, I hope I see you face to face very, very soon. Thank you for sticking with me through this.